You're listening to the HWP Report, bringing you news and information about issues pertaining to health, wellness, and performance, with your host, Dr. Faiz Kirsten.
Greetings, everyone, and welcome to this podcast of the Health Wellness Performance Institute. The Institute merges root cause medicine with empowerment programs, thereby helping people to prevent and reverse chronic illness and to optimize their health and wellness. Our 3-month program focuses largely on assisting patients who have been experiencing ongoing struggles with cancer, autoimmune diseases, and neurodegenerative diseases such as Parkinson's disease and dementia, amongst others. We do, however, also assist patients with other chronic diseases such as diabetes and hypertension, for example, and who are interested in reversing these conditions. The Institute also offers various health and wellness products and educational courses. So visit us at the link below to learn more about the Health Wellness Performance Institute.
By financial empowerment, what I mean is not only empowering the patient, but also empowering the doctor and the patient. There's big cost savings, with the membership-based model. If you pay a monthly membership to your doctor and then you have unlimited access, you don't have to pay every time you see the doctor. But with the empowerment programs also, then you're becoming empowered and your health and wellness improves, and that reduces the risk of future hospital events, and there's cost savings in the future also. So this model, there's big cost savings, related to this model. I'm also talking, when I talk about, financial empowerment, I'm talking about reducing the risk of being financially wiped out in the coming global economic crash. We're in the crisis, the crash, nobody knows when the major part of the crash is going to happen, but the specialists tell us that we're already in the process of crashing. And all fiat currencies are going to come crashing down with everything else, in this massive global economic crash that's going to happen. And so we need to prepare for that. And this model that I'm presenting today, is my thinking and my contribution, perhaps, to help solve it at least on one level. Okay, and there's a war on cash happening at the moment also. It started in India. Venezuela now is outlawing cash. I think Spain and Greece maybe and some European countries are starting to ban cash. Now, David Icke said this a while ago. He said the war on cash is a war on freedom. I've been warning about the cashless society for decades. It's a massive trap. When all cash is gone, how do you buy anything when the computer says no to your digital money? Exactly, that's the idea. So it's very serious when you cannot even control and keep in your possession your own money, and it has to be held by the banking system. That, I think, if people really don't wake up to the seriousness of this situation, then I'm not sure if anything will really wake them up. So, this is the next step, and it's a massive step in the march towards total control, of the people around the world. So, yeah. So I'm just going to summarize quickly then. I'm done now. I spoke about two problems. One is the global health and economic crises, and then the crisis must be seen within the context of the globalist agenda. And part of the solution, as I said, is to merge medicine with health, wellness, and financial empowerment. I know there's some questions going to be posed, and I'm not going to mention them, but these are the questions that will come up. And I'd like to thank you for your attention. I really do appreciate it. Thank you very much. Alberto, I'm done. Thank you.
Greetings, everyone, and welcome. What you have just seen are two excerpts from a webinar on merging medicine with health, wellness, and financial empowerment, which I did a few years ago. The link to this webinar is below if you would like to watch it. Now, as you may be aware, the global economy is in the process of disintegrating right now as we speak. I'm sure you're aware of the fact that this is happening. And in this webinar, I discuss my thinking and contributions to circumventing these crises. And this really encompasses two things. The first is actually the formation of the Health Wellness Performance Institute, which I set up several years ago, actually. And the link to the Institute's website is also below. My second contribution to getting around these crises was the setting up of community exchanges. Now, in 2003, I was part of a group of 10 people who set up the community exchange system, which is at www.ces.org.za, if you would like to have a look at that website. But more recently, I set up the ZA Dinar exchange, which is linked to the Institute, but which is actually currently inactive. And I will activate it when membership of the Institute is at a level which actually justifies its activation. And you can read more about the ZAD now exchange, at the link below also. Now, if you would like to discuss membership with me, or if you have any questions or comments or inquiries about the Institute or the exchanges, let me know. My email address is Faiz, that's F-A-I-E-Z, at brainscience, which is one word, brain plus science, .co.za. Faiz at brainscience.co.za. We could discuss, on the Zoom platform, which I use often. It's quite a user-friendly platform. You may be familiar with it or not. So if you'd like to discuss these matters with me on the Zoom platform or any other way, let me know, and then we can have a chat. Okay, so now in my previous newsletter, I mentioned that there is much hype and fear and panic around this virus, okay? And measures have been taken which could result in the disintegration of the global economy. Now, I must mention though at this point that I'm going to refer to this virus as the crown virus throughout this podcast, primarily to circumvent AI censorship, which possibly could happen, but also to draw attention to the fact that it is the globalist elites, including royalty, kings and queens and royal families and so forth, besides other players who are behind, what the world is experiencing right now. Now, the proper name for this virus is actually SARS-CoV-2, okay, because of its genetic similarity to the virus responsible for the SARS outbreak in 2003, okay? And the term COVID-19 refers to the illness caused by the SARS-CoV-2 virus, okay? Which, as I mentioned, I will refer to as a crown virus, and because corona actually means crown in Latin. Anyway, in my previous newsletter, I also mentioned that there is no irrefutable evidence that a new virus is causing this apparent global pandemic. And at the time of its writing of the newsletter, this was my understanding. I had not found any credible proof for the existence of such a virus in my research at the time that I published the newsletter. However, I now learned that there is evidence that the virus is actually an artificial or synthetic biological structure. It was created at the University of North Carolina at Chapel Hill in 2015. And you can read the details in an article entitled "Engineered Bat Virus Stirs Debate Over Risky Research, Lab-Made Crown Virus Related to SARS Can Infect Human Cells." Now, it uses the other word, but I'm saying crown. Published on the 12th of November 2015 in the science journal Nature, and the link is actually below also. Now, please note there's a deceptive editor's note which was inserted on the 20th of March, at the top of this article, and it states that we are aware that this story is being used as the basis for unverified theories that the novel crown virus causing COVID-19 was engineered. There is no evidence that this is true. Scientists believe that an animal is the most likely source of the virus. Now, obviously, the article itself really contradicts what this editor's note states, but you can read the article for yourself and decide for yourself. But you will be glad to know that I'm not just a bringer of bad news. There is a good side to this story also, and it is that the crown virus is actually a self-limiting virus. So healthy people with a strong immune system and low toxic burden will either experience no symptoms following exposure to this virus or mild fleeting illness, okay? And most people will recover within 24 to 48 hours. On the other hand, though, people carrying a heavy toxic load and are immunocompromised are definitely at risk, of severe illness and death. Okay, so now before discussing the reasons for all the hype and other issues that I intend to discuss on this podcast, I want to firstly just briefly talk about how to prevent contracting this infection, which includes, of course, obviously strengthening the immune system, and also how to treat, this crown virus infection, when one does get infected with it. So just a reminder, though, that in order to optimize your health and wellness, it is important to adopt an holistic approach. And if you are familiar with my work, I'm always advising people and my patients to adopt an holistic approach, because you can't really treat an holistic human being, with a one method approach. Let me put it that way. If you only just treat the biological side of the human being, it's not adequate, or just the psychological side, the social side, the spiritual side. It's really a good idea, especially in people with chronic illnesses, to adopt an holistic approach. But really, in everybody, even if you're not sick, and you want to just optimize your health and wellness, it has to be a holistic approach. Anyway, okay, to protect yourself from getting infected, then it's important to obviously keep washing your hands regularly with soap and water, and 20 seconds, minimum, soap and water, wash your hands. And this actually causes disintegration of the virus. But also avoid touching your nose and mouth with unwashed hands. Is very important. And avoid close contact with infected people. Infected people should, of course, quarantine themselves, stay at home or somewhere away from the public. It's important also for infected people to cough or sneeze into a disposable tissue, and obviously get rid of that. And to wear a face mask when coming into contact with others, to prevent infecting them, since the virus is also transmitted not only through touch, but through droplet inhalation, okay, from the air. Now, non-infected people should also wear a face mask, to prevent inhaling the virus. And it's important also to clean and disinfect surfaces regularly, especially those that are touched frequently. Now, to strengthen your immune system, obviously the first thing really is to optimize your nutrition. This is key. So you got to avoid all processed foods, especially processed sugar, and eat only whole foods, including lots of fruit and vegetables. This is very important. These contain obviously a wealth of vitamins, antioxidants, and many other phytonutrients. Of course, when you strengthen your immune system, you should do physical exercise regularly, and this is really a powerful immune booster. So if you're not in the habit of exercising regularly, then I strongly recommend that you start getting into this habit of exercising on a regular basis, physical exercise. But also don't forget to do regular mental exercises, okay? You got to keep your brain, active and strong also, and your mind. So also get sufficient sleep and rest. It's vital to implement proper sleep hygiene practices. And then you also want to minimize or eliminate chronic stress, because that'll decimate your immune system, if you're chronically stressed, especially chronic psychological stress. And I actually discuss how to do this in my book, Goodbye Stress, How to Live Stress-Free, where I go through in quite a lot of detail how to actually control your chronic psychological stress and eliminate it, preferably. But also reducing exposure to physical and chemical stresses is crucial, is very crucial, of course. So you also got to improve your gut health to boost your immune system, because most of your immune system is actually associated with the gut. And so you want to take a good probiotic, and there's many other measures that you want to take also to improve your gut health, but we're not going to be discussing that in this podcast. A few other supplements, that you want to take to strengthen your immune system are basically vitamin C, which is really an extremely powerful antioxidant and anti-inflammatory. So in crown virus infection, massive inflammation actually occurs in the lungs and causes a buildup of thick mucus in the airways. So this causes serious difficulty with breathing, and it actually causes respiratory failure. And vitamin C is actually an extremely powerful immune booster. So really, I strongly recommend you take, high-dose vitamin C. You can also take liposomal glutathione, which is another powerful antioxidant, and you can also take N-acetylcysteine, which is used in the production of antioxidants, including glutathione production. Okay. Now, vitamin D3, very important to take together with vitamin K2, because vitamin D deficiency is extremely common. Okay. So make sure you boost your levels with regular exposure to sunlight, and obviously take in the supplement, a vitamin D3 supplement, and vitamin K2 with it, as I mentioned. Also eat superfoods such as garlic, ginger, and spirulina on a regular basis, and preferably daily if you can. Also try to stop smoking. If you are a smoker, best to stop smoking. And if you're a non-smoker, avoid secondary smoke. Okay, in other words, avoid inhaling cigarette smoke from other people who are smoking. But also, if you're a drinker, try to minimize. If you drink alcohol, minimize it, consumption, or stop consumption. If you can. That'll also go a long way to improving your health and also to preventing your immune system from being negatively impacted upon by these habits. Okay, so now the following specific treatments are currently being recommended by experts. I'm just going to mention them, not really discuss them in detail. One is melatonin that you can use, to kill this virus. Colloidal silver is very good. A homeopathic remedy called gelsemium, okay, that's very good. Molecular hydrogen has been found to be really excellent for this crown virus infection. Carbocysteine is a mucolytic. We mentioned that you get thick mucus being formed in the airways when you have this infection. So carbocysteine it breaks down the mucus, all right? And there's an anti-malarial drug called chloroquine. Now, I'm not a very big fan, as you may know, of synthetic pharmaceutical drugs in chronic illness or acute illnesses, except though in emergency situations. And I would, I'm not really against synthetic pharmaceuticals, but on a long-term basis, I'm really not pro synthetic pharmaceuticals. But I'm mentioning it here because it's been shown to actually have antiviral activity against the crown virus. So there are other antimalarials which can be used, and there's two of them, which is hydroxychloroquine and nitazoxanide. Now, another thing that you can use is angiotensin receptor blocking agents such as Diovan and Cozar. All right, so that's the treatment of crown virus infection. But coming back to the likely global economic disintegration, or which seems to be a very, very big possibility that the global economy is going to crash. In light of this, it is crucial to view or to analyze negative or chaotic or destructive events which occur locally or globally in terms of the unfolding globalist agenda. And the purpose, of course, of this agenda is to bring about a totalitarian new world order. And I, of course, discussed this agenda as the underlying root cause of the global health and economic crisis in the webinar, the excerpts of the webinar which we've just seen, okay? So now, this is how researcher and writer Tim Bryant describes the New World Order. I think it's very important for everybody to understand what the New World Order is all about. And I think this is a very nice description from or by Tim Bryant. So he says from the start, it's important to understand the distinction that the New World Order is not necessarily one specific group or one specific law, but more of an over-encompassing ideology. An ideology is a worldview and belief system that guides an individual, group, social movement, class, or institution. The basic concept behind the ideology of a New World Order is international collectivism, where power and law within societies is increasingly centralized into fewer groups so as to transcend nations and move power and law into international bodies and institutions in the belief that world law benefits the collective people of the world over decentralized local law. Therefore, the idea of a new world order is not simply a single policy, domestic group, or international organization, but instead encompasses an international ideological movement toward the construction of a global governance system. Okay, global governance. There is no doubt that within this ideology, certain patterns of people, organizations, and tactics continually emerge over and over again to lead the charge. While many are benign to this movement, these same groups and individuals know what it's about and frequently refer to the idea of this new world order in their writings, speeches, and literature. It is a true conspiracy for a new world order of international collectivism that a majority of the public is not even aware of. And I've discovered that over, the years that I've been doing research into the globalist agenda and the new world order, or it's the same thing really, an agenda for a new world order, you can say. I've discovered that many people are not aware of it, okay? But I think now with the global lockdown, I think many people basically are aware of it. Anyway, in order to understand the globalist agenda, it is important really to understand the pyramid of control, okay? So here you see a diagram of the pyramid banking system structure. Now, according to Ronald Bernard, who was a former international financial dealer serving the banking industry and an ex-Illuminati employee, and this is according to himself, but he's now become a peacemaker. He says the number of people running the world is only 8,000 to 8,500, which is really minuscule compared to the total global population of about 7.7 billion. Now, these people, he says, sit at the top of the pyramid of global control. And so let's call this top of the pyramid of global control the peak of the pyramid of control, or the PPC. Okay? Now, these people and their predecessors formed the Bank for International Settlements, okay, the BIS, from the Netherlands in 1930. And they located its headquarters in Basel, Switzerland. Now, the PPC, okay, controls the international financial system by managing and controlling those working, here at the BIS, okay? And then orders flow down through the pyramid from the Basel headquarters and ultimately to the governments of virtually every country on the planet. Now, in this way, the economic, financial, and indeed all systems of these countries are managed and controlled. So every central bank is a member of the Bank of International Settlements, which is really a private corporation and not a public or government body or agency. And it's not only Ronald Bernard who's actually saying what I've just described. There are other authentic sources which actually confirm what Bernard has said, okay? And in fact, you can watch the interview of Ronald Bernard on YouTube. You can just search for Ronald Bernard interview and it should come up. All right. Okay, so the entities immediately below the Bank of International Settlements in the pyramid of control is the World Bank and the International Monetary Fund, which then provide assistance to struggling countries when these countries need this assistance. And then below the World Bank and the International Monetary Fund, you have your central banks. And these central banks then in turn control the commercial banks and the stock market centers, which then in turn control the corporations, okay, the transnational, national corporations below them. And then these corporations then control governments below them, which themselves are governments, of course, are corporations, of course, so governments are corporations. And then the governments in turn then control the people below them. So this is the whole pyramid of control, all right? But there are other globalist institutions via which the New World Order is being implemented, and they include institutions like the Royal Institute of International Affairs, the Council on Foreign Relations, the CFR, the Trilateral Commission, the United Nations itself, the Bilderberg Group, the North Atlantic Treaty Organization, the Tavistock Institute, and hundreds of non-governmental organizations also, NGOs as they are known. Now, you may be familiar with the work of author Fritz Springmeier, and in his book, Bloodlines of the Illuminati, he says there are 13 bloodline families which control the world, but according to other sources, there are other related and associated families which are also driving this globalist enslavement agenda. Now, the Global Elite website actually lists 68 families which rule the world. So you can actually see this list at the globalelite.org//globalists website. Okay, I'll actually post the link below also. However, although the role of these families in the diabolical agenda is important, there are other far more important players who operate behind the scenes and out of the public eye. as they push to make, this sick plan of theirs a reality. So the people and families that I've mentioned are basically just the public face of the New World Order, right? They're not the real leaders of the globalist agenda. The real leaders are never seen or nor heard of, by the public or even the most astute of academics, all right? They are the ones who basically control the Jesuits, which is the International Military Order of the Society of Jesus, and the Military Intelligence Service of the Vatican. All right? It was established by Pope Paul III in 1540. And so the Jesuit order largely controls the so-called Illuminati and has really been running the Vatican since the days of Napoleon. And of course, the Vatican controls the Catholic Church. Now, although it's believed that the Jesuit order is controlled by the Jesuit Council, which in turn is controlled by the Black Nobility Council, which is under the control of the papal bloodlines, the truth is that those who control the Black Pope and everything below him and the Jesuit order, in other words, the real leaders of the globalist agenda, as I said, are never seen or heard from, by the public or even academics, as I just said. Knowledge of these people's existence was actually made possible thanks to the study of world history in non-mainstream universities and education institutions, okay? And it's actually taken very deep research, much digging and reading of hardly read and hardly heard of books, really, catalogs and treatises, to really acquire the knowledge of who the wicked people are who are driving, this diabolical globalist agenda from the dark shadows. Of course, right at the very top of this entire pyramid of control, even above the PPC that I mentioned, is Satan, okay? The devil, okay? Who is now actually under the control of an overarching dark force, which I will not expand on in this podcast and perhaps in another. But anyway, coming back to the pandemic scare, which is sweeping the world at the moment, it's important to remember that the term pandemic simply refers to the worldwide spread of a disease, right? It doesn't necessarily refer to the lethality of the disease. In other words, how many people it kills. So on this point, let's have a look at the figures. Now, on the 28th of March 2020, which was just the other day, the Worldometer website published the following statistics relating to the crown virus, okay? And we'll put that link below also. Now, it states that the total number of cases on this date, 28th of March, was 613,882. And the number of deaths was 28,231. But the number of people that recovered so far up until that point in time was 137,247. Now, as I mentioned, most healthy people recover within 24 to 48 hours, all right? We'll discuss the validity of these statistics later, but for now, let's compare the number of deaths from this virus with deaths from other infections and other illnesses in 2020, right? So the deaths in 2020 so far, since January this year, 2020, number of people who died from communicable diseases, total number of people who died from all the different communicable diseases from the beginning of January this year up until this point, 28th of March, was 2,959,783. And this includes people dying from the seasonal flu. And the number of people who died from the seasonal flu was 110,823. So deaths from the COVID-19 illness due to infection with the crown virus, if you take the number of people dying from this disease as a percentage of the total deaths from communicable diseases, the percentage is actually 0.95%, which is less than 1%, actually a fraction of 1%, right? So the number of deaths from crown virus as a percentage of the total number of deaths from communicable diseases is a fraction of 1%, like I said. Now, if you compare this figure of 28,231, the number of deaths from the crown virus this year so far, with the number of deaths since January 2020 from other causes, all other causes of deaths, you'll find that if we just compare these figures, compare 28,231 with malaria, number of deaths from malaria, which is 209,636, number of deaths from suicides, 229,184, and you can see on the list here, the number of deaths from all these different causes far exceed the number of deaths from infection with the crown virus, all right? So the point is this, given these figures, is it not extremely strange that a significant number of the global population has effectively been placed under house arrest to prevent the spread of a virus which has caused the deaths of less than 1% of the people who developed a communicable disease this year, okay? But if you compare, this figure of the percentage of 0.95% really pales, into insignificance when compared, to the total number of deaths this year from all causes, right? So the total number of people who died this year is 14,133,000 so far, okay? And the deaths from COVID-19 as a percentage of total deaths is 0.002%, which is an even smaller fraction of 1%, all right? So a pandemic really is associated with at least 1 million or more deaths, all right? So this is hardly really a pandemic in the true sense of the word, all right? Now, however, and this is a very important point, given the many silent weapons which have been deployed by the globalists on the world's population for decades now, including pharmaceutical drugs, which we know are deadly, and they do kill many people, many people every year, including processed and genetic modified foods, toxic vaccines, and unnatural electromagnetic radiation, which have already killed, all of these silent weapons have already killed many people over many decades now. And now 5G is being added to the arsenal of these silent weapons. It's likely, of course, that hundreds of millions will die in the near future, okay? But not from the crown virus, okay? There will be many deaths, but not from the crown virus. Although, as I did say, anyone with a compromised immune system, if they are exposed to the crown virus, they are at high risk of actually not surviving that experience. Okay, but also with the extreme toxic burden that humanity is carrying, including massive amounts of EM radiation, like we said, the immune systems of multitudes are already decimated, all right? And as I just mentioned, with the deployment of 5G, which has been proven to destroy the immune system, it would obviously be highly unreasonable to not expect the deaths of hundreds of millions and more likely billions of people in the near future. All right, and there are studies which show that the 5G radiation, millimeter waves, does actually destroy the immune system. Okay, so there are studies, and I will post the links to these studies below. All right, so this is very important that when 5G is employed, and we think that 5G is already playing a role in the deaths of people with the crown virus infection. Okay, but we'll talk about that later in the podcast, if not this podcast, not this part of the podcast, because this is part one, maybe in the second part or the third part, I'm not sure yet. All right, so what I would like to do now really is to draw your attention to a report published by the Rockefeller Foundation and the Global Business Network in May of 2010. That's way back, almost 10 years ago. And the title of this report is Scenarios for the Future of Technology and International Development. And you can download a copy of this report at the link below, okay? So the first scenario narrative which was discussed in this report is called Lockstep, which actually describes a world of tighter top-down government control and more authoritarian leadership with limited innovation and growing citizen pushback. And it goes on to say, and I'm going to read directly from the report, okay? So what I'm going to read now is directly from the report. It says, in 2012, the pandemic that the world has been anticipating for years finally hit. Unlike 2009's H1N1, this new influenza strain, originating from wild geese, was extremely virulent and deadly. Even the most pandemic-prepared nations were quickly overwhelmed when the virus streaked around the world, infecting nearly 20% of the global population and killing 8 million in just 7 months. The majority of them healthy young adults, okay? The pandemic also had a deadly effect on economies. international mobility of both people and goods screeched to a halt, debilitating industries like tourism and breaking global supply chains. Even locally, normally bustling shops and office buildings sat empty for months, devoid of both employees and customers. The pandemic blanketed the planet, though disproportionate numbers died in Africa, Southeast Asia, and Central America, where the virus spread like wildfire in the absence of official containment protocols. But even in developed countries, containment was a challenge. The United States' initial policy of strongly discouraging citizens from flying proved deadly in its leniency, accelerating the spread of the virus not just within the US, but across borders. However, a few countries did fare better, China in particular. The Chinese government's quick imposition and enforcement of mandatory quarantine for all citizens, as well as its instant and near hermetic sealing off of all borders, saved millions of lives, stopping the spread of the virus far earlier than in other countries and enabling a swifter post-pandemic recovery. China's government was not the only one that took extreme measures to protect its citizens from risk and exposure. During the pandemic, national leaders around the world flexed their authority and imposed airtight rules and restrictions, from the mandatory wearing of face masks to body temperature checks at the entries to communal spaces like train stations and supermarkets. Even after the pandemic faded, this more authoritarian control and oversight of citizens and their activities stuck and even intensified. In order to protect themselves from the spread of increasingly global problems, from pandemics and transnational terrorism to environmental crises and rising poverty, leaders around the world took a firmer grip on power. At first, the notion of a more controlled world gained wide acceptance and approval. Citizens willingly gave up some of their sovereignty and their privacy to more paternalistic states in exchange for greater safety and stability. Citizens were more tolerant and even eager for top-down direction and oversight, and national leaders had more latitude to impose order in the ways they saw fit. In developed countries, this heightened oversight took many forms: biometric IDs for all citizens, for example, and tighter regulation of key industries whose stability was deemed vital to national interest. In many developed countries, enforced cooperation with a suite of new regulations and agreements slowly but steadily restored both order and, importantly, economic growth. Across the developing world, however, the story was different and much more variable. Top-down authority took different forms in different countries, hinging largely on the capacity, caliber, and intentions of their leaders. In countries with strong and thoughtful leaders, citizens' overall economic status and quality of life increased. In India, for example, air quality drastically improved after 2016, when the government outlawed high-emitting vehicles. In Ghana, the introduction of ambitious government programs to improve basic infrastructure and ensure the availability of clean water for all the people led to a sharp decline in waterborne diseases. But more authoritarian leadership worked less well, and in some cases tragically, in countries run by irresponsible elites who used their increased power to pursue their own interests at the expense of their citizens. Okay, so obviously it's a very long report, but I would highly recommend you read the report. But especially the scenario narrative, which is entitled Lockstep, which I mentioned, and I just read an excerpt from that. But I would really recommend that you read the Lockstep at least, but the entire report if you can. Okay, and remember, diabolical minds work. The modus operandi is deception. Okay, so the modus operandi of diabolical minds is deception. So when you read the report, just keep that in mind, all right? Anyway, so it's clear from this report, very clear from this report, that its producers have actually carefully analyzed the socioeconomic and political consequences of a global pandemic more than a decade ago, okay? And an equally as sinister, although more recently, the World Economic Forum, together with the Bill and Melinda Gates Foundation and the Johns Hopkins Center for Health Security, ran another global pandemic simulation, okay? It was called Event 201, and it took place 6 weeks before the first report of the crown virus outbreak occurred in China. And amazingly, this simulation was almost identical to the first phase described in the Lockstep scenario narrative, okay? But this, of course, is hardly surprising, to those who are aware that it is the Rockefeller Foundation that actually set up and funded the Johns Hopkins School of Hygiene and Public Health in 1916. And the two organizations have actually been in close collaboration ever since and have conducted many diabolical projects around the world since then, such as the human experiment in Guatemala in the 1940s, where they intentionally exposed the poor and vulnerable people of this country, to sexually transmitted diseases. It's also not surprising that the Bill and Melinda Gates Foundation was also involved in Event 201, given the eugenics background, that of Bill Gates. And in fact, this foundation, Bill and Melinda Gates Foundation, gave tens of millions of dollars to the Bill and Melinda Gates Institute of Population and Reproductive Health, which is actually located inside the Johns Hopkins Hospital. And this institute works on depopulation programs under the guise of population and reproductive health, okay? So as I just said, deception is the modus operandi of diabolical minds, all right? So one has to be very careful when analyzing, information and the likes thereof. Okay, so remember, Bill Gates is very staunchly pro-vaccination, okay? And vaccines have been proven to not only be destructive to human health, but deadly too, okay? In other words, vaccines kill, all right? So then, to summarize, the lockstep scenario actually describes the sudden outbreak of a viral pandemic across the world, okay? If you read it, you'll see that's what it says. It drastically reduces the mobility of people and the supply of goods and services, which we're basically seeing right now with the global lockdown. And global supply chains and industrial activity are paralyzed, and the economies of nations are destroyed, okay? And in this scenario, basically, what lockstep is describing, governments, under the guise of public health risk posed by the pandemic, governments around the world exert total control over their people. And the people, of course, despite resenting this takeover of their lives, don't resist it because they are told it's being done to protect them, all right? And the eventual outcome of this lockdown of the world and the takeover of people's lives is a global totalitarian system in which humanity is totally controlled by technology. Of course, the lockstep scenario is exactly what the world is experiencing right now, okay? It's basically what lockstep has described, is basically what we're seeing now, okay? Okay, so thanks for watching, and don't forget to subscribe, to our channel if you want to be kept updated, and also press the notification button, all right? Thanks again for watching, and we'll see you in the next part 2 of this podcast on the coronavirus, 5G, and the New World Order.